Imagine being faced with a critical mental health situation. A service user is in crisis, and you need to make immediate decisions. But wait, what does the law allow you to do? What are your legal obligations? One wrong move could put both you and your service user at risk. Today, we're breaking down the essential laws you must know in mental health care. This isn't just about compliance, it's about protecting lives while staying within legal boundaries. Core mental health legislation, Mental Health Act, 1983, amended 2007. Key provisions: defines criteria for compulsory detention, sectioning, outlines treatment rights and consent requirements, establishes safeguards for detained patients, defines roles of mental health professionals. Important sections: Section 2, assessment detention up to 28 days. Section 3, treatment detention up to 6 months. Section 117, aftercare services. Section 135/136, Emergency Intervention Powers, Mental Capacity Act, 2005. Core principles: presumption of capacity support for decision-making, right to make unwise decisions, best interest decisions, least restrictive option. Key features: capacity assessment framework, lasting powers of attorney, advanced decisions, court of protection roles, deprivation of liberty, safeguards, DOLS, Care Act, 2014, primary elements, well-being principle, prevention duties, integration of care assessment rights, safeguarding responsibilities, key responsibilities, needs assessments, care planning, personal budgets, information and advice, Market Shaping Human Rights Act, 1998, relevant articles. Article 3, protection from inhuman treatment. Article 5, right to liberty. Article 8, right to private life. Article 14, protection from discrimination, Equality Act 2010. Protection against discrimination, direct discrimination, indirect discrimination, harassment, victimization, protected characteristics, mental health conditions, disabilities, age, gender, race, data protection, Act 2018, UK GDPR. Key requirements: lawful processing of health data, confidentiality, maintenance, information sharing protocols, subject access rights, security measures, practical application in care settings, daily practice requirements, capacity assessments documentation, consent recording, care plan updates, incident reporting, safeguarding procedures, emergency situation protocol, risk assessment documentation, use of emergency powers, professional consultation, record keeping requirements, communication protocols, rights, protection, service user involvement, advocacy access, complaint procedures, appeals process, family involvement, professional responsibilities, documentation requirements, accurate record-keeping decision-making process, capacity assessments, best interest decisions, incident reports, safeguarding duties, recognition of abuse, reporting procedures, investigation cooperation, evidence preservation, witness statements, compliance tips, regular reviews, policy updates, procedure checks, training records, documentation audits, risk assessments, best practice guidelines, clear communication, regular supervision, team meetings, case reviews, professional development, risk management, prevention strategies, intervention protocols, emergency procedures, review mechanisms, learning implementation. Remember, these laws exist to protect both service users and care workers. Understanding and following them isn't just about compliance, it's about providing safe, effective, and dignified care. Action points: review your organization's policies, update your training records, check documentation procedures, know your emergency protocols, maintain professional development. Final thought: legal knowledge in mental health care isn't optional, it's essential. Keep this guide handy, stay updated with changes, and remember, good care is always legal care. Want to ensure compliance? Schedule regular team reviews of these laws and their practical applications in your care setting. Knowledge shared is knowledge strengthened. Subscribe for more. You can check the video on mental health crisis responses.